Don't you know there are some factors responsible for your bad erection? As a man, your manhood has to be at alert whenever it's needed to work. Before we move into the real business as we are having it for today, there are some certain things I really want us to understand. An erection depends on healthy blood vessels, nerves, hormones, and the brain working together as one. Even small lifestyles, habits, repeated every day can interfere with this process. The good news is that many of these habits can be changed. So now, let's take a look at some common habits that may affect erectile function. That is, there are some habits that can actually affect your penis not to be erecting as it is expected. Number one, smoking. Smoking Smoking is one of the leading preventable causes of erectile dysfunction. That is, the chemicals in cigarette smoke damage blood vessels and reduce nitric oxide, a substance that helps blood vessels relax. And without enough nitric oxide, blood flow to the penis is reduced, making it harder to achieve or to maintain an erection. So that is, I really want us to know that men who stop smoking often see improvement in their vascular health over time. That is point number one. Another habit that affects or that causes erectile dysfunction is this: drinking too much alcohol. Drinking too much alcohol. How does that affect our erection? This is just because small amount of alcohol may not cause problems for most people, but frequent heavy drinking can actually affect the erection. Alcohol can cause this. It can actually reduce the testosterone levels. It can slow the nerve signals. It can decrease sexual performance. It can also make it difficult to get or maintain an erection. That is, long time excessive alcohol use can also damage the liver and the nerves also as well, further contributing to the erectile problems. I really want us to take note of this particular aspect. So another habit that could or that can affect the erection is this also: lack of physical activities. This also affects a lot. Lack of physical activities. How does that affect the penis erection? Because a sedentary lifestyle affects circulation throughout the body, including blood flow to the penis. Regular exercise helps to what? To improve the blood vessels functions, and it helps to lower the blood pressure also as well, and it helps to reduce the excess body weight, and also it improves hormone balance, and also it helps to increase energy and the confidence. Yes, that is the reason why even 30 minutes of brisk walking most days of the week can even support cardiovascular and the sexual health. So I really want us to take note of this also. Another habit that contributes negatively to bad erection is this: poor diet. Poor diet. This is just because a diet, a diet in high processed foods, sugary drinks, and the unhealthy fat can contribute to the obesity, diabetes, and the high cholesterol. This condition can actually damage blood vessels and they reduce the blood flow in the body. That is, a healthier eating pattern include fruits, vegetables, whole grains, nuts, fish, healthy oils. These foods supply healthy circulation of blood and it helps the blood system a lot. Another habit that actually contribute negatively to the bad erection is this: poor sleep also. Poor sleep. How does the poor sleep affect the erection in the body system. As we all know that sleep is an essential for hormone production, including testosterone. Men who consistently get to little sleep may experience lower testosterone, reduced sex drive, fatigue, increased risk of erectile dysfunction. So that is, aim for about 7 to 9 hours of quality sleep each night is very, very important. Another factor that contributes maladjustments to the erection in men is this: chronic stress and anxiety. Chronic stress and anxiety. How does that affect the erection in men? I really want us to understand some facts. I really want us to understand some basic facts about how stress can affect penis erection. Stress affects the brain, which plays a major role in sexual arousal. When you are under chronic stress, the body releases hormones like cortisol and adrenaline. This can interfere with the sexual desire and make it more difficult to achieve or maintain an erection. So, stress management techniques such as regular exercise, relaxation, and adequate sleep may help a lot. It may help a lot. So, another habit is this: ignoring health conditions. Ignoring health conditions, because persistent erection problem may be linked to conditions such as diabetes, high blood pressure, high cholesterol, heart disease. In some men, erectile dysfunction can be an early sign of blood vessels disease. If erection problem continue for several weeks or months, it's a good idea to see a healthcare professional rather than ignoring them. This is very, very important. So now, in conclusion, your erection can reflect your overall health by avoiding smoking, limiting alcohol, staying active, eating a balanced diet, sleeping well, managing stress, and treating medical conditions, because many men can support both their sexual health and their general well-being. Remember, occasional erection difficulties are common and can happen for many reasons. So, after taking all this into consideration, after all the necessary steps towards this habit have been taken, however, if the problem is persistent, seeking medical advice is important because it may be a sign of an underlying health condition. Thank you for listening. Stay healthy, stay active, and take care of your health, because a healthy heart supports a healthy erection. So if this channel is so helpful to you, kindly hit the subscribe button and follow us for more so you won't miss our next class. Thanks for watching.